My name is Gabby and I am one of the vet assistants at All Creatures Animal Hospital, and we are back today for our puppy talk. I know last week we had some technical difficulties, and last week my goal was to kind of break everything up into segments so that people had a chance to ask questions and just really talk more in detail about the certain topics that I've gone over before that are previously on our Facebook page and our YouTube channel. So today I'm just going to take some time to talk about the vaccine and kind of wellness portion for puppies as they're growing up. So feel free to comment, send us messages if there's something that maybe I didn't touch or questions that you have. Please let us know and I can answer them, or I can reach out to you personally and answer. I'm here typically towards the end of the week, so I just want to help and make everything as easy to understand because there's a lot of information for these guys. So again, my name is Gabby. I'm the one who does our puppy talks here at All Creatures Animal Hospital. We typically have them every Saturday from 1 to 3, but right now with everything going on with the coronavirus, we have improvised and done a Facebook Live video plus added a video to our YouTube channel. And that's at All Creatures Animal Hospital, Georgia. So please check that out. We'll start talking about, like I said, some health stuff. So we'll talk about vaccines, a typical schedule for these guys, and then we'll talk about flea tick prevention and different insurance wellness plans that we have. So as far as puppies, they start off with getting boosted around 7 weeks of age. So their typical vaccine schedule would be 7, 10, 13, and 16 weeks. Depending on if you got them from a breeder, from a pet store, from a rescue facility, the vaccines could vary. So when you come in, we typically look at all of your vaccine histories, see what vaccines have been given, when they've been given. So when puppies get vaccines earlier than 6 to 7 weeks of age, they don't count necessarily because their body still has all their mom's immunity. And as they're building their own immunity at that 6 to 7 week mark is when vaccines really start to count for these guys and start to build their own immunity as well, so that their body can protect themselves versus just what they're getting from their mom at an early age. So around 6 to 7 weeks, they get their first distemper, which is also referred to as a DHLPP, and that is a 5-way vaccine. So that's distemper, hepatitis, lepto, parainfluenza, and parvo. They also get their first Bordetella, which a lot of people relate to the kennel cough vaccine, but it's much more than that. So instead of it just being kennel cough, we now call it CIRD, which is canine infectious respiratory disease. It is made of multiple upper respiratories that we are protecting these guys from, so it's not just the kennel cough strain. There are other upper respiratories with bacteria that we're protecting for them as well. So just like these guys, they can get things outside of just the kennel. It's not something that's just if you're boarding these guys that you need to get that Bordetella vaccine. So they get their first one at 7 weeks along with the first distemper. They do get boosted every 2 to 3 weeks, and they get 4 rounds of that distemper, hepatitis, lepto, parainfluenza, and parvo vaccine. And they also get 2 rounds of the Bordetella vaccine. So 2 to 3 weeks after they get their first round of vaccines, they'll get their second distemper and their second Bordetella. And at 12 to 13 weeks of age, they get their rabies vaccine. The rabies vaccine is only done one time. It's not something that has to be boosted, but that is required in the state of Georgia, so we do highly recommend that when they are of age to get that vaccine. So again, we try to keep everything on that schedule, so the 7, 10, 13, and 16 week timeline to keep those boosted so that all these babies are on track and you're not having to come back every week to do vaccines. We really try hard to combine everything together so you're not having to make multiple trips, but we can also make sure your baby is up to date. For their first visit, in addition to looking at vaccines and seeing if anything is due, we recommend doing a fecal float exam, which is sent out to an outside lab to test for parasites, intestinal parasites on these guys. super common for these guys to get. So there are such things as Giardia, Coccidia, roundworms, whipworms, lots of different intestinal parasites that are super common for these guys to get. Again, they're building their immunity, so there are a lot of things that these guys are going to go through that we need to treat that are super common. It's not hard, but it's just things that are necessary for these guys. So they are very much like babies. There's a lot of care that you have to do in the beginning, but if you stay on top of everything, it really makes their life a smooth transition for you as well, because you'll be on a good schedule, you'll have everything taken care of, and if you're up to date, it just makes for less hiccups later on down the road. So we'll do the fecal float, and depending on how that comes back, we recommend a deworming medication, which could vary depending on the parasite. And then after that, we recommend you bringing a fecal float back to recheck to make sure that there's nothing else going on, they haven't picked something else up, or to make sure that they've been treated properly and we've gotten rid of the parasite. So in addition from these guys, they can get it from their mom, they can get it out in the environment with wildlife, they can pick up things out in the yard, just going outside and walking in the grass, even if you're really good about keeping them clean. If there are other people that are walking their dogs in that area, or stray animals that may be leaving stuff behind, and our puppies are always going to have their mouths into stuff and wanting to pick up things they're not supposed to, that gives them a higher risk of picking up things like other parasites. So we highly recommend doing that fecal float just to make sure that we're all clear, taken care of, and if we need to do any additional medication for that, we can take care of that and get it done, before it stays there too long and it's not being treated. So we do recommend doing the fecal float. We'll also, during their first visit, we start them on a heartworm prevention, and sometimes, depending on the product that we have in stock, there's also a flea and tick combination with it. Our go-to is Revolution, which is a topical flea, tick, and heartworm prevention. It doesn't do all species of ticks, but just does enough for, at least to get them started at an early age. So it does one kind of tick, and it's a topical product. It lasts for 30 days, and it's an alcohol base, so it's something that dries very quickly. It doesn't have a strong odor to it, and super safe to use on these guys as early as 8 weeks. So we typically do get them started with that Revolution, and sometimes we do have it in stock. So this is the box, so you guys can kind of see what it looks like. This is for the size of under 5 pounds, but they obviously change with weight. So as your baby gets older, that weight range is going to change for the most part. So we do start them with a dose when they come in for their first visit, and then after 30 days, it's your responsibility to follow up with the product on a monthly basis. You can either get it from our online pharmacy, which is Vet's First Choice, which is great, super simple to use, and you can get the medication shipped right to your door, which is fantastic because you don't have to worry about going elsewhere for it. Or if we have the product in stock, you're more than welcome to get it from us. But we don't always keep a huge stock of everything, and a lot of our stuff goes fast, so getting set up on the online pharmacy is probably the easiest, most consistent way, and it also can be set up on a regular shipment, so you're not having to worry about remembering another thing to order. It will just come directly to you, and you can apply it the same day every month. A couple other products that we do recommend that we may have used for your baby is Interceptor, which is a chewable heartworm prevention. And in addition to that, you'll still need to do a flea and tick prevention. So we do recommend Credelio. Those are both safe for young puppies. So those are 2 oral medications that you can use to stay on top of the flea and tick prevention. So those are great. And you can order those from the online pharmacy as well. And we also try to keep a stock of that too. So if you have gotten those products before and you need to keep up on a monthly basis, definitely give us a call and we can see if we have it in stock. But the online pharmacy is the best to go to. It just really helps make everything simple so that you can get everything and you don't have to make an extra stop. Once they get to 6 months of age, there are some products that we do recommend to switch to. So there is a product called ProHeart, which is an injectable heartworm prevention, which is really great. You don't have to give a product monthly. You just give the injection every 6 months, and we line it up with your yearly and your semi-annual exams. So that's really great. It's a great product to use. We also have a flea and tick medication called Simparica. And the reason we recommend Simparica over most other products is because it does all breeds of ticks as well as fleas. So you're getting the most coverage between those two products. You can always use other products. There's many products out there such as Trifexis. You can continue on Revolution. You could continue with Credelio and Interceptor. There's Frontline, HeartGuard. So really you could do your research, see what products that you're interested in. You're more than welcome to call us and we can guide you and help you. You're not required to do one product over the other, but those are just our best options to get the most coverage. Unfortunately, there is not one product that does everything. So with the Revolution or the Credelio and Interceptor, when they're young puppies before 6 months of age, those are probably the best products out there to get them on to make sure that they're fully covered for flea, ticks, and heartworms. And then also as far as when they are 6 months or older, they can do the ProHeart and the Simparica, which is the best coverage for these guys when they're older as far as flea, ticks, and heartworm prevention. So we can talk to you in more detail. We try to remind you when you come in for your appointments, and we do send reminders in your little portal if you have the Pet Desk app, so it tells you when your time is up to get your heartworm prevention refilled or your flea and tick prevention. Another thing we do during your first visit is we'll do the nail trim. We obviously do the full physical exam, so we make sure everything sounds good, looks good. That exam goes from the tip of their nose to the base of their tail. Make sure everything looks good, there's no lumps, bumps. And that exam we do recommend every 6 months, and that's a semi-annual exam. So they should be coming in twice a year to make sure that everything's good, just as we would do for our doctor. We go in at least twice a year to make sure that everything is good. So same concept for these guys. We want to make sure that they're on top of their wellness stuff and coming in every 6 months for the exam, and we can line that up with their yearly vaccines so you're not having to make multiple trips, and make sure you're stocked with your flea, tick, heartworm prevention as well. Once they get older, we do recommend doing the heartworm test on a yearly basis, which just allows us to make sure that everything is good, there's no heartworms noted, and we can continue the preventative. So that is something that's a prescription base. You can't get these heartworm preventions over the counter. And then we also recommend continuing to do the fecal float test on a yearly basis to make sure they're not picking up anything as they get older, especially if you're taking them to dog parks or taking them out a lot. Even if you live in an apartment complex, they're being exposed to a lot of things. So super important for these guys to get their fecal float done on a yearly basis. And we also recommend doing their deworming, which is a strategic deworming that we do. We recommend. It doesn't hurt them, but it just helps kind of flush the system out so that if they do happen to pick something up, they're kind of preventively getting medication for that, just to make sure that there's nothing lingering until their next yearly visit or their 6-month visit. So after you've done all of your puppy stuff, going back to kind of your puppyhood things, after you've gotten all your vaccines by 16 weeks of age and you've come in every 2 to 3 weeks up until that point, once you're done with your last distemper, the next thing would be getting your baby spayed or neutered between 6 and 9 months. So at 6 and 9 months, it's highly recommended to get them spayed or neutered. So it's not, just a procedure that we like to do for fun. There are health reasons that we recommend it. So one, for females, it reduces their risk of ovarian cancer, mammary cancer. It does help with some of, there can be aggression that comes with having all those hormones. And obviously for the females going into heat, there are spotting and things that come along with that. And also they can attract a lot of males into the yard too. And then there's also, for the males getting neutered, it reduces their risk for testicular cancer, prostate cancer, and also helps with some behavioral stuff so they can become aggressive having too many hormones. We have dogs that break out of yards because they smell females from miles away, and that reduces the risk for that. And also helps because both female and male can start to mark, and that can also come into your household as well. So to prevent those things, it's better to spay or neuter them. It's healthier, it gives them a longer lifespan. If you decide to wait, just waiting, the longer you wait past that 6 to 9 month period, you're just increasing your risk for developing some of those cancers, because their body is overworking with all those hormones. If they're not breeding and using those hormones the way that they're meant to be used, as far as like breeding them, it can really reduce their lifespan, and they may not live as long. It can heighten their risk for cancer. So super important to get these guys spayed or neutered. Highly recommend doing it at the 6-month mark. But if you have any questions, you feel like you want to wait, we're here to help you. There's no judgment. We just want to do what's best for you and your baby. So if you do have any questions, feel free to ask us during one of your appointments, and we can go through more information about that. It is a drop-off procedure, so it's an outpatient, and these guys are really resilient. I personally had abdominal surgery last summer, and how it took me to recover in, at least a month of rest. With these guys, when they have a small abdominal incision or any kind of incision, these guys are back to normal that evening or the next day, and it's amazing. Their pain tolerance is completely different than humans. So don't feel guilty or feel like you have to be there 24/7 for 10 to 14 days after their procedure. So it's an outpatient procedure. You bring them in the morning, typically drop off by 9 o'clock, and they're here for the day, depending on what day it is. Sometimes we do surgeries mid-morning or early afternoon, and then we schedule a pickup time for the evening. And by that evening, they're typically back to normal, and most work that you're going to have to do is just keeping them calm. They do have to wear that cone of shame or that e-collar for 10 to 14 days after the procedure, just to make sure that they're not getting any of their sutures out or licking their incision that can cause a secondary infection. So definitely want to make sure that they're staying on top of that. And then after the 10 to 14 day mark, you'll bring them in, we'll take the sutures out, or just check the incision to make sure everything's good, and then they're free to go. So it's pretty quick for the most part. Just have to be a little patient with them, trying to keep them quiet for a couple of weeks. We do also require blood work. So the blood work is done anywhere from at least 3 days prior to the procedure, anywhere to 30 days from the procedure. So we do a full panel blood work, just like we would get done prior to a procedure, to make sure organ function is well, and to make sure that everything is functioning properly before we put your baby under anesthesia. So we want to do all the preventatives that we can to make sure that their procedure is safe and smooth, just like we would have done prior to our procedures as well. So after that 6 to 9 month mark, and you get your baby spayed or neutered, after that, it's really just 6 months from then, we'd recommend you coming in for your yearly exam, which, like I said, we combine all your vaccines that you do, as well as making sure that you get your heartworm test done, your fecal, deworming, and we do recommend the blood work on a yearly basis. So after you get them spayed or neutered, typically around a year from then is when we'd recommend doing the full panel blood work, just to make sure everything is functioning properly, just as we would do when we get our yearly vaccines or blood work done. So also talking about some health stuff, there are a couple different insurance plans that we have or recommend. So a couple insurance. So one is Trupanion, which is great, but it is more of an illness insurance. So they do work more like human insurance. I know a lot of people have questions like what pet insurance is best. So Trupanion is great for emergencies. So like I said, they work a little more like human insurance. So we are one of their express hospitals, which means that if you sign up for Trupanion and say you have to bring your baby in because they're having, diarrhea or something, you bring them in and we say, okay, well, we recommend doing some fecal diagnostics, and then we recommend doing some medications. Since we're an express hospital, we can submit the estimate or treatment plan that we give to you, submit it directly to Trupanion, and pending on the plan that you submitted or signed up for, and what your, not the deposit, but your, trying to think, my brain is not cooperating, but your premium or whatever, I guess is the best word for it. it will come to me later. You just pay that. Your deductible is what I'm trying to say. You pay for your deductible price, and then the rest would be covered by your Trupanion plan. So if the estimate was $300 and you chose the $50 deductible, you'd pay your $50 deductible. Trupanion would pay the rest of the plan. They would pay us directly, so you're not having to pay anything out of pocket besides the small portion that you signed up for. They have a lot of different varieties of plans. They even have these for cats, but it's good to get them at a young age for puppies or kittens to do this and get on top of it and just have it, because when you want it during an emergency situation, it's going to be too late. A lot of these plans have a certain period of time that you have to be enrolled before they'll start covering things, and also if your pet has had certain things before, like diarrhea, a lot of diarrhea cases, or ear infections, they won't include those things to be covered under your insurance because they're pre-existing conditions. So if you can get on top of it and get started now and before anything happens, you'll have it. You may not use it. You may use it once or twice, but I just know it would be really great to have, because a lot of people ask when it's an emergency situation, and unfortunately there's not many options. You know, we do offer, you know, taking care credit or scratch pay, which are a couple different options to help, kind of like credit card / loan things that can help. But if you have the insurance, it's really worth it. So definitely I would recommend this as a wellness insurance plan. Really great. Another plan or another company that I do recommend is Nationwide. So Nationwide is a great plan as well, or company. They do have wellness and illness plans, which are great. So maybe if you wanted to do both, you could do wellness for this one, illness for this one, and have both of them just ready to go. So the wellness portion would cover for your puppy boosters, your yearly vaccines, certain plans. They'll cover your preventative. So if you're buying flea, tick, and heartworm prevention, you'll be getting money back for that. The only difference with Nationwide is that it's not like human insurance. So you do have to pay the full cost up front, and then you submit your invoice and they'll give you a portion back pending on what plan you chose. If they give you 75%, 60%, but you have to pay everything up front. So you just have to be prepared that, you know, you still have to pay the cost, but that in a couple of weeks, once you submit that invoice, they will send you a check reimbursing you for the portions that they cover under your plan. But they have a waiting period too, so it's good to get started early, you know, on these things and just have it ready to go. And it's better to have it and not need it than to not have it and wish you had done it and you could need it in the future. So that's really a great option as well. And in combination with these insurance plans, we have an amazing thing called a Petly Wellness Plan, which I love. It is a wellness plan. It breaks everything up into monthly payments. So, you know, versus insurance where you still have to pay things up front, this kind of breaks everything down into monthly payments. And we do have specialized puppy plans and adult plans as well as senior plans. So we have all stages of life for these guys. So the puppy plans include all of the puppy vaccines. We have two different plans. So one of them does cover the spay and neuter. And then you can eventually kind of go up and graduate into the adult regular plans, and then eventually when they become seniors, they go into the senior plan. So what does the Petly plan include? The Petly plan includes unlimited office calls. So that means anytime you need to come in and see the doctor, whether it be Dr. Mike, Dr. Linda, or Dr. Carolyn, you get your office call included in your Petly plan, so you don't have to pay that $60 every time you come in. Since you're enrolled in the Petly plan, you get that as part of your package. All of your yearly vaccines, so your distemper, your rabies, your bordetella, your heartworm test, all of your yearly stuff is included in the plan, as well as your full blood work package. So that blood work package I was telling you about, like your screening package, or we call it a comprehensive package depending on their age, that is included as well. When they get older, we can include dentals on here, so that if your dog needs a dental cleaning in the future, we have that included in here as well. We have the spay and neuter included on here for when they're young. And we can also add the ProHeart that we talked about earlier as far as the heartworm prevention, that injection. You can add the ProHeart on here as well. So that kind of helps being able to split all those payments up. So these are great plans. We are starting to adjust some of our prices, so please be patient with us. If you do call and have any questions, we can definitely go over pricing for you depending on what's left with your puppy, as far as your puppy's vaccines and things like that. If you're interested, we can get you some costs, but it's a great thing to have. I've had it for my dogs before, and it just really helps break everything into monthly payments so you're not overwhelmed with having to drop a good portion of money every time you come in. It just kind of breaks it up, and you can come in and everything's covered and you don't have to pay unless it's something outside of that Petly plan. So that Petly plan is only wellness stuff, so that doesn't include illness. So if you are coming in for something outside of your yearly or just wellness stuff, you know, those are things that we would add on, but we always go over treatment plans and make sure you're okay with things that we're recommending doing before we do them for your baby. So we are on your side. We want to help and make everything as smooth and easy as possible. So outside of the wellness plans, and then we have the insurance. As far as wellness things, you know, it is super important to stay on top of, you know, brushing teeth with these guys. So, you know, it is something you should do twice a day and brush their teeth. They do have doggy toothbrush and toothpaste. So I don't have the toothpaste here, but you do want to make sure it's a doggy version. You can't just use the toothpaste that you get at the store. But you can use, some of the toothbrushes look just like ours, and they also have finger toothbrushes that you can use for these smaller guys, but it's good to get them used to the idea of having their teeth cleaned. So I talked about you could add the dentals to these packages, and you know, little dogs, they definitely build up plaque and tartar a lot quicker than bigger dogs. So it's good to get them used to it now as a puppy and just start practicing. Put your finger in there and just kind of rub it around their teeth so they kind of get the idea of what it feels like. Put a little toothpaste on your finger and just run it on there so they get used to the taste, and just slowly work up to doing one of these toothbrushes. Right now, while they're tiny and babies and they still have their baby teeth, it's just good to get used to a routine, and for them to get used to a routine. You know, their teeth should be brushed twice a day, and that will push out you having to put them under full anesthesia for a dental cleaning, you know, at least 2 or 3 years down the road, if not longer, depending on your pup and how big they are. But it's super important because unfortunately these guys don't just sit there and keep their mouths open when we're, you know, having to clean their teeth. So we do have to put them under full anesthesia. And so if we can reduce the number that we have to put them under anesthesia to get a full dental cleaning, if you're able to keep up with brushing teeth at home, there's products such as things you can put in their water. There are chews that you can get. There's greenies. So you could find a couple different combinations that could work best for you and your routine. But it's good to start thinking about those things now while they're young so that you can prolong them having to go under anesthesia for the dental cleaning until they're, you know, at least 2 or 3 years of age. So as far as the wellness, that is really about it that I have on that. A lot of people will ask, well, why do I need to be on a flea, tick, and heartworm prevention when my dog is typically inside? And the thing with that is, even though they may be inside most of the time and you only take them out for a very short period of time, a couple times a day, fleas and ticks can still travel inside your home on us. So even though you may not see it, something could come in on a piece of clothing, on a shoe, and if you get one flea, they can multiply to an extreme amount in a very short period of time. And then you can have an infestation which could require a lot more treatment as far as, you know, bombing your house, having a pest control person come in. So if you could just stay on that preventative and avoid all of that situation, it would be so much easier than playing that gambling game and risking the fact that your dog could get infested with fleas. And it's not so much that you're not doing what you're supposed to do, but other people may not be on top of their flea preventative, and if you walk by one dog that happens to have fleas, that flea could jump off onto your dog and come in the house, and if they're on the preventative already, they will be protected, plus it will reduce them spreading into your home. And same with ticks as well. Even though you may not be going hiking or being out in a heavily wooded area, there's still that chance that ticks could be transferred from wildlife or other bigger dogs that may go out and be exposed to a lot of big, heavily treed areas that could have a lot of ticks. And as far as heartworm prevention as well, heartworms are transmitted through mosquitoes. And I know, as well as everybody has probably had the experience where they never have their windows open. They rarely go outside, and a mosquito still happens to, sneak into your home, and you wake up in the middle of the night or in the morning with a bug bite, and you don't know how you got it. So mosquitoes are very easy to sneak in the house, and they are the ones that transmit heartworms. And heartworm treatment is extremely expensive. It's a very long, slow process. You have to keep your animal calm because these are parasites that infect their heart, truly. So super important to keep on these guys on a monthly preventative and to stay on top of that. It's just so much easier and cheaper to just stay on the preventative. And we all are humans, we all make mistakes. I know I sometimes forget or miss a day on my preventative and end up being a day late, but if you could really try to stay on top of it and do what you can, even if you have to buy a month at a time, and just to help, make sure you stay on top of it for your babies, because it's super crucial and something that's super simple that you could prevent. And we just want to educate you on the reason why we recommend these products, not just for the fact of wanting to sell you something. It's because we want to protect your baby so that they have the best, healthiest life that we can give them. So that's super important. So again, when they're puppies, we recommend Revolution. And then once they're 6 months or older, one of the products we recommend is Simparica, which is the flea and tick prevention. And then we recommend ProHeart with the Simparica once they're 6 months or older. Another thing as far as wellness is I'll hear, sometimes people will mention with large breed dogs that they want to wait until they're 18 months of age because it could stunt their growth, or I hear it's spay or neuter that people feel like it's going to change their personality, or, they're not going to act the same. And to be honest, it doesn't change their personality. Not spaying or neutering could change their personality, where they could become territorial or aggressive. But spaying and neutering them doesn't change their personality at all. It's a very simple procedure. We do all that we can, and especially when we have our normal puppy class, bringing these guys here to socialize in the clinic and it to become a fun thing makes it so that it's always fun to come here, and it's not just for shots or getting neutered or spayed. So once we're able to do these puppy classes, that will really help on taking that idea that once they get spayed or neutered here, they're never going to want to come back. Because I have dogs or puppies that came here for puppy class a couple years ago, and they still come in super excited, ready to see us, and it's always a positive experience to them. Even though they've been spayed, they've had their yearly vaccines, they get all the things done, but we always make it a positive experience for these guys so that they're not scared to come to the vet. We want it to be a happy experience, and we do all that we can to make sure that happens. And it doesn't stunt their growth either. So in regards to the large breed dogs, I had a Great Dane that was just about 6 months old when we neutered him. And he grew up to be full grown at 160 pounds, a little overweight actually. And it didn't stunt his growth, it didn't change his personality. So that is just something, if you really feel comfortable and you'd rather wait, that's perfectly fine. But like I said, it's highly recommended to get these guys spayed or neutered at 6 to 9 months of age, when they're in their prime, before their hormones really start to spike, so that we can reduce their risk of cancer. And also, just give them a longer lifespan. That's really our first goal, is to make sure that they're healthy and that they can live the longest life that they can. Other than that, I know I throw a lot of information at you guys, and it's a lot to do, just to absorb. And being in the field, it's easy for me to remember all these things, but I know it can be very overwhelming. So if you have any questions, again, like I said, my name is Gabby. I'm one of the vet assistants, and I'm here Wednesday through Saturdays. So please call, reach out. They can make notes for me to specifically call you back, and we can talk in detail. I've been trying to reach out either through our clinic texting or giving personal phone calls to make sure that everybody is good and you've had a great experience with your new puppy, and make sure there's no questions or concerns. Like I said, we have our video on YouTube, which goes through my entire puppy talk, all 4 sections, and I do have some more like potty training and crate training tips. Next Saturday, I'll go through crate training and potty training in detail. So I'll go through all of that, but I just wanted to tackle kind of like the wellness stuff and the puppy booster type situation. So if you have any questions, definitely reach out. Our number is 770-393-3400, or you can reach out via Facebook or through our texting, and we can definitely reach out and make sure we can answer any questions if I haven't touched base on that. But I hope everybody is staying safe and healthy, and they're enjoying their new fur babies at home. And I will be back next Saturday at 1 o'clock to talk about crate training and potty training. So if you have any questions or things you'd want me to talk about, please, please, please comment on here, message us on Facebook so I have questions to go over. And please let me know if there's any feedback on these videos, because I'd really love to know how you guys at home love the videos, or if there's something that maybe I'm not covering that you would really appreciate me talking about. So please reach out, and I hope everybody has a safe, healthy, happy weekend, and I will see you guys next Saturday.